All right. All right. Give me just another couple minutes and we will get started. Give me just a sec. All right. I was told, hmm, I was told that this meeting says 6:30 Mountain instead of 5:30. I think we're kind of all on different time zones. So hopefully that doesn't cause too much confusion. I don't know what the issue is. It might be, I don't know, something with the time change, or I might have put it in wrong. So anyways, we are gonna dive into our topic for today. Let me see, let me check one more thing. Give me just another couple seconds and we will get started. All right. All right, looks good. Let me go back to, here we go. All right, thank you for your patience, everyone. I am your host. I'm Dr. Katie McCalley. Let me make this my full screen. Actually, I want to make sure that I can see our chat. So if you are viewing this live, feel free to chime in, introduce yourself on the chat. I am going to use that as a way to answer questions if and when they come up. So use the chat feature. If you have any questions, I will keep an eye on that. If you are watching this as a recording, you can always comment or reach out to me directly. And as always, I'm happy to support you however I can. Again, my name is Dr. Katie McCalley. I am your host tonight for our weekly wellness webinar. This week, we are covering foot pain. Oh, this is a really good one, you guys. I'm super excited. I love talking about feet and foot function because it is so incredibly important. And it affects a lot of people, and there's not a lot of resources out there for what we can do about it. So I am here to help with that. So a little bit about me. I am, again, Dr. Katie McCalley. I am a chiropractor. I practice in Colorado Springs. If you are local to the Colorado Springs area, I would love to support you or help serve you in any way that I can, or just get to know you, answer any questions that you have. If you are from afar, I'm still happy to support you however I can from afar. Always feel free to reach out to me, and I'm here to be a support to you. I have been a chiropractor for 8 years, and I just moved to the Colorado Springs area and opened up my new practice. It's called High Altitude Chiropractic. It's over on the west side off of Garden of the Gods Road, about a mile west off of 25. So if you need a chiropractor in the Colorado Springs area, I'm here to help. Otherwise, I'm just here to support you on your journey to give you tools and resources, and or give people you know and love tools and resources. So, like I said, tonight's topic is foot pain and function. Okay, why do I even want to talk about this? Well, the reality is that most of us in this world have feet. And if we have feet, then we stand on them all day. We use them all day, every day. We use them consistently. So, the problem is that it is really easy for foot function to kind of go awry, to kind of get away from us. And the problem is, like I was saying, people don't really know what to do about foot pain. They don't really understand why it happens, and they don't know what to do to support it. Sorry, I'm going to mute my phone so that we don't get any dings. So, anyways, the reality is that when we have foot pain and dysfunction, it affects the whole rest of our body too, because we stand on our feet. We are weight-bearing people, individuals. We live on Earth where there's gravity. So everything is affecting us when we have foot pain and dysfunction. And we're going to get into a little more of that as we start to understand how the foot functions and why it malfunctions, what happens when things go wrong. Again, there's a lot that people don't know about feet, but that's why you're here. And this webinar is to help you. So along that line, why do I do these webinars? If you've seen one of my webinars before, you already know that my purpose here is just to get information out to you, to your loved ones, to your coworkers, anybody who this can support. I got really frustrated seeing all of the frustration with people trying to do the right things with different ailments that were bothering them, and just not knowing, just not having the tools, not having the resources. And because of that, it dramatically affects a lot of people's lives, and it's avoidable and preventable. And all it takes is just a little bit of information, a little bit of knowledge. And that's what I'm here doing. That's what I'm trying to get out to the world, that there are options, there are things that can be done. And I'm just trying to help a few people, or a lot of people, know a couple more tools for your toolbox for things that you might be dealing with. So if you are having foot pain or dysfunction, if you know of somebody who is having foot pain or dysfunction that might be affecting them, they might not know what to do. You might not know what to do. Hopefully this helps, and hopefully this gives you some information. And like I said, if you have questions as we go through this, then please feel free to let me know. This is an open forum. I'm here to chat with you guys. Excuse me. And I am going to drink some water because hydrating is really important, and I haven't done a great job of that today. So this is your friendly reminder. If you also haven't done great with your water intake today, now's a good time to go get a sip of water. Okay, you do that while I dive into our foot topic. So how does the foot actually work? What you might not know is that there are actually 26 different bones in the foot. All of them are designed to move independently of in cohesion, but independently of the others. Well, what happens in today's world is we shove our feet into foot jail, which is shoes. I call shoes foot jail because that's what it is. And our 26 bones of our foot, they like clump together. And then instead of having good foot function and mobility, where our feet splay when we walk, and our feet mold to the earth like how our ancestors did, we don't have that anymore. And our feet get shoved into foot jail shoes, and then they just like turn into clumps of bones that we like waddle around on. It's not, we're not having the full range of mobility in our feet. So the other thing that we do is we walk around on entirely flat man-made surfaces, not the terrain of the earth, where our foot gets the opportunity to mold to the earth and move a little bit with the surface underneath the foot. We walk on flat concrete sidewalks and streets and whatever. And that's not really conducive for proper foot mobility or foot function either. So these are some of the things that are happening with our feet. Yeah, I said that. Okay. So when the feet don't move properly, when the bones of the foot don't move properly, we ultimately get foot pain. So pain is a really good indicator that something isn't working right. Now, a lot of us are really bad about experiencing pain. A lot of us don't do a good job with it. We say, oh, it must be nothing. Oh, I'm being a baby. Oh, suck it up. And here's the thing. Pain is our body's warning system that something isn't functioning right. So listen to it and do something about it and maybe pay attention to it so that you can prevent maybe a bigger injury or a bigger problem down the road. Um, some of you guys might call foot pain plantar fasciitis. It's a really big word that people love to say. A lot of people don't know what it means. So I'm going to tell you what it means. Plantar fasciitis is literally inflammation of the fascia on the plantar surface of the foot. The fascia is it's almost like a layer of muscle on it's actually over all the muscles in the body, but we talk about the plantar fascia and we call it plantar fasciitis. So how do we get plantar fasciitis? Well, what happens is the bones in the foot don't move properly. They clump together and they get jammed up, and then that creates inflammation in the plantar fascia. We call it plantar fasciitis. Itis is inflammation. So the bones aren't moving and they haven't been moving for a long time. We get pain on the bottom of the foot. It hurts to take our shoes off. It hurts to walk. It hurts to do anything. This is foot pain. This is plantar fasciitis. So this actually affects a lot of people. I'm sure you know somebody who has dealt with foot pain or plantar fasciitis. The problem is people don't know what to do about it when they get foot pain. So this can actually be very debilitating for some people. We stand on our feet. You might have a job where you stand. You might be active. You might be a parent, whatever. You need your feet. You need your feet. But people just don't know what to do when they get foot pain and dysfunction. So what they might do is go to their medical doctor and they'll be told, there's nothing you can do. I'll give you a diagnosis. You have plantar fasciitis. Can't do anything. Stay off your feet. Who does that work for? Stay off your feet. Also, what good is that going to do for you? Besides help you gain weight and be more unhealthy. So, the medical doctor might say, ooh, this is pretty bad. I'm going to give you some pain medication, which of course we know is just a Band-Aid. Do you remember our analogy from last week? This is the same thing. Your check engine light comes on in your car, and instead of taking it to the mechanic and finding out the problem that's causing your check engine light to come on, you take a little piece of black tape and you just put it right over your check engine light and say, isn't that better? Good to go. And keep driving around as if everything's good. That's exactly what pain medication does. First of all, your body is sending you a signal that says, hey, something's not right. And instead of saying, oh, let's get to the bottom of this and figure out what's not right, what's going wrong, what do we need to do to make sure this is functioning right? No, we're not going to do any of that. We're going to put a piece of black tape over it by taking pain medicine and being like, yeah, okay, we're good. Even then, a lot of times pain medication doesn't even work, especially for something like plantar fasciitis when you are constantly on your feet and aggravating the tissues that are already inflamed. So in addition to that, we all know by now, hopefully, that those medications and pain medications, things like that, that our medical doctor might give us, they are creating a whole nother host of issues that we're going to have to deal with at some point because we're taking this medicine. And are we going to take pain medication forever? Are we going to is our foot pain magically going to get better because we covered up the symptoms of pain? No. So we either need to actually get to the root cause of the problem or maybe take pain medication forever, which I think we all know is a terrible idea. So, the other thing that people do is they just avoid doing things that they genuinely, truly love because they don't know what to do about it. I have such horrible foot pain. I can't go on hikes anymore. I can't go on walks with my neighbor anymore. I can't play with my kids anymore. I can't do these things. So people just stop doing things that they love. And oftentimes that also leads to people becoming more unhealthy, like I can't go on my hikes, I can't do my walks anymore. So what happens? I gain weight, and then I'm sedentary, and then that affects my mental capacity, and then that also worsens all of my other problems. Now I'm at risk for diabetes. I mean, you see how this could be a really problematic thing. So, okay, so that is why foot function is really important and what happens to most of the world when they get foot pain. But let's talk about what to do. What to do when our feet are not functioning properly. Our feet aren't functioning properly. Something's not right. I don't want to take pain medication. I don't want to avoid doing the things that I love. What do we do about it? So don't worry. I have some tips for you. Let's dive in. Okay. First and foremost, take your shoes off. Take your shoes off. I'll say it again. When you get home, take your shoes off. You should take your shoes off right away, but that's not enough. Take your shoes off. Take your socks off. Let your feet spread. Let your toes splay. Go into your backyard and walk around on the earth in your bare feet. Can you believe it? Yes, I said it. That is going to promote good foot mobility. If it's super sensitive on your feet, that's a really good sign that you need to be doing it more. So make that part of your routine, part of your habit. Walk around outside in your bare feet. It's really good for grounding too. Like we talked about stress management last week. This is a good way to just ground and connect with the earth and just be present. But it also really promotes good foot mobility. It keeps the bones of the foot moving properly. Okay, so that is the first thing to do. Walk around your house barefoot. Spend as much time barefoot as you can. That's really good for you. We also have those toe separators. I have some, but I didn't grab them. And those can be really good too to help remind your toes to splay. So imagine my hands, my foot. Our toes, our feet are like kind of like used to being clumped together like this, right? We need to remind our feet to open and splay. Sometimes those toe separators can help do that. Number two, get better shoes. Okay, here's the thing. I don't know who created tennis shoes, but whoever did a terrible job, because the thing that happens is every tennis shoe, not every, most tennis shoes are built with a heel lift. So that means that the heel, if I'm holding a shoe, the heel is thicker and the toe is narrower, is thinner, right? So we're all essentially, so imagine a shoe like this, thick on the back, thin on the front. So we're all walking around on little tiny miniature high heels. Now we know that high heels are not good for our feet. We know that high heels are not good for our backs or our pelvis, any of that. But we all wear them in our tennis shoes, in our athletic shoes, in our shoes that are supposed to be what supports our body the best. And it is so foolish. What you need to look for is what we call a zero drop shoe. That means regardless of how it looks, because I think sometimes they some of the zero drop shoes, they try to make it look cooler so that it, fits in a little bit better, but you're looking for a zero drop shoe. So it should be the same width in the back as the front. That is what you want to walk around on. That is very important. Number two, you need to find a wide toe box shoe. And you might say, Katie, I don't have wide feet. It doesn't matter because you have feet. And when you step on your feet, your metatarsals, which is the midsection of your foot, is designed to splay. Any shoe that is not a wide toe box shoe does not allow enough room for those metatarsals to splay out, which is really what creates healthy foot biomechanical movement. So you are looking for zero drop and wide toe box. Those are very important things. There's several brands out there nowadays. You can find them in dress shoes and cute shoes and tennis shoes and running shoes and hiking shoes and whatever you want. They have them out there. The brand that I really like is Ultras, Altra. Ultras, I love them. I've worn them for years. I think they do a really great job. They have a great product. They have a really good guarantee also. I'm pretty sure you can try them out. And if they don't work for you, you can send them back. I'm going to tell you right now, get rid of your big fat puffy shoes that everybody seems to like these days. I know that they're comfortable and I know they make your feet feel so good, but I promise you, you are not doing yourself any favors by walking around on big chunky puffy shoes. You need to feel the earth. You should be able to feel when you step on a rock. You should be able to feel what's underneath your feet. If you can't, if your shoes are so thick that you can't, that's creating improper biomechanical patterns of your gait. So, without getting too technical, get better shoes. Zero's another brand. There's some good brands out there with zero drop and wide toe box. Okay. So you can, if you are already experiencing foot pain, doing those things already is going to make a huge difference. But you can also roll out your foot on a tennis ball. Now, this is a really good trick because you can roll to tolerance. You can put as much pressure or as little pressure as is appropriate for you, given the state that you're currently in. This is going to do two things. One, it's going to massage out the muscles on the bottom of your foot, which is a good thing because they're tight now. Plantar fasciitis, remember? Number two is it's going to promote mobility of the bones in the foot. So that's a really good tool. I hear this a lot with patients coming in with foot pain. They say, it is unbearable first thing in the morning. I cannot even stand up out of bed without feeling like I'm going to fall over. Here's my trick for you. If you are one of those people, first thing in the morning before you do anything else, you wake up and you stand up on your bed. Stand up on your bed and you walk around. Walk around your bed back and forth for 1 to 2 minutes. This is a soft surface that slowly starts to wake up your feet so that when you do step on the hard surface, your feet are already a little bit more mobile and it helps a lot. Okay, all of these things are really good tools for if you're having foot pain, but there's one that is the absolute most important, and that is get your feet adjusted, not just your feet. Go to your chiropractor and get adjusted. First and foremost, we know that proper mobility and alignment in the pelvis means that our leg length is the right proper alignment as well. That means that we're not trying to compensate lower down the chain with our feet. But it doesn't stop there. Pelvic mobility is very important for proper biomechanical patterns of the lower extremities. But I will encourage you to go to a step further than that. I'm going to say get your feet adjusted and get them adjusted by somebody who knows how to adjust feet. There are not a lot of chiropractors who know proper foot adjusting techniques. They might do a little movement, a little something here and there. And I'm telling you right now, that's not enough. We can do better. I can adjust every single bone in the foot specifically and effectively. I teach extremity adjusting. I teach adjustments in the foot. If you are not in the Colorado Springs area or if you are and you want your chiropractor to learn how to adjust feet properly, please reach out to me. I'm more than happy to support them. I teach extremity adjusting for chiropractors to support them so they can better serve you and other people because this is a problem. Nobody knows what to do for foot pain. So getting adjusted is very important. Now remember, there's 26 different bones in the foot and they are all supposed to be moving. So, what else? Seriously, this is a really important thing. If you are experiencing foot pain and dysfunction, if you are having anything along those lines, getting your feet properly adjusted, I do not say this lightly, it will change your life. I have seen it over and over again. I've given you other tools with the tennis ball and the proper shoes and walking around barefoot, all of that, but you have got to get your feet adjusted properly. They are designed to move. And truly and honestly, your life will change if you get your feet adjusted properly. I don't say that lightly, but it is very important. So if you don't have foot pain, why wait? Why wait until you have foot pain? That's one of the silliest things that we do in our culture today, in our health care system, which is really a sick care system. That is something that we just, well, I'll wait till it hurts. I'll wait till I'm sick. by that point, it'll take at least triple the effort to fix it, especially if we're going to fix it from the root cause. But we could just skip all of that and just start practicing good habits right now. So if you don't have foot pain, fantastic. Let's not wait until you do. So start taking your shoes off, start walking around in your backyard with bare feet on, with bare feet. Grab a tennis ball, roll out the bottom of so I'm not saying sit and roll the ball on your foot. I'm saying stand, set the ball on the ground and put whatever amount of weight is appropriate and roll your foot back and forth on that. And you will notice. And if that's too easy, try a golf ball. Don't start with a golf ball. It hurts. Okay. So don't wait and get the right shoes. Remember, zero drop and wide toe box, and get your feet adjusted. Get your feet adjusted. Come to Colorado Springs. I will adjust your feet for you, or send your chiropractor my way and I will help train them so that they know how to best support you and your foot function. Okay, today we have covered, I really had to speed along with that because there's so much to talk about in the foot, and I have so much more I want to share with you guys, and I will, but it won't all be tonight because these should be short, digestible little pieces. So we have covered foot structure, foot function, why feet are so important, why we get foot pain, and then what to do about it when we get foot pain, and then how to prevent foot pain from taking over our lives altogether. So I feel like we covered some really good background information, which I hope was not confusing. And I think that we have some really good resources about what to do if we're experiencing foot pain or someone we love is experiencing foot pain, and how to prevent getting foot pain just from the beginning, because that's really the way to do everything in life. Prevention is key. If you haven't learned that yet, that's like the secret. That's the secret to life. Preventing bad things from happening is really the way to go, because we don't do a very good job of fixing bad things that happens in our healthcare system these days. So if we can just prevent it from happening, we are really in a good place. So that is the information I have for you tonight. That was a little bit rapid fire. I hope you were listening. I hope you were taking it all in while you were drinking your water. Real quick before we go, if anybody has any questions or any comments, if anybody's watching live, please go ahead and comment that now. If you are watching a recording of this, you can comment on whatever platform you are watching. Otherwise, you can reach out to me directly. My name is Dr. Katie McCalley. I am a chiropractor. I am on Facebook and Instagram. My business is High Altitude Chiropractic, High Altitude Chiro_CS on Instagram, Facebook, High Altitude Chiropractic, or Katie McCalley. Send me a message, reach out. I am here to support. That is why I do this. That is why I am passionate about this. We do these webinars every Tuesday at 5:30 p.m. Mountain Time. If the time change messed anybody else up, then join the crowd. I am not a fan of daylight savings. I think next week is ear infections. Don't quote me on it. If it's not next week, it's coming up, but I'm pretty sure next week is ear infections. That's what we're going to cover. So again, if there's anything I can do to support you, I am here for you. If you have not yet, please register for next week. That'll be again Tuesday at 5:30 Mountain Time. I'm pretty sure we're doing ear infections. So you don't want to miss that one. I have some really good information for you on that, and for your little ones too. And it makes a really big difference. So I hope you feel confident about your foot pain and foot function. If there's anything that you want to share about any of this, let me know. I have talked to a lot of people, a lot of patients who they really feel like they get their quality of life back after their foot pain gets under control. So I'm hoping that that's the case for you and or someone you know and love. That is all I have for you. Thank you so much for tuning in. If you watch this live, thank you for taking time. If you watch this as a recording, otherwise, we'll see you next week. I am here to support you in any way I can. You guys go have a wonderful evening and a great rest of your week. Bye, guys.